Bosch, doing a video from home about the lung ultrasound and the coronavirus outbreak, hoping to decrease chest x-ray CT utilization as resources are becoming more limited. I was just told that routine echocardiograms are not being done, and so we've got to reconsider how we're doing management of patients with shortness of breath, heart failure, pulmonary edema, etc. So we're going to review a couple things. We're going to review pneumothorax lung ultrasound, and then we're going to go through the identification of A lines and B lines in the lung tissue that coincides with either normal lung tissue or interstitial fluid, which, as you know, is nonspecific, but it can be infectious fluid, it can be pulmonary edema, it can be diffuse lung injury. And so these things will be fairly clear to see on ultrasound. But before we start, I want to show you guys some pictures of the ultrasound machine. Hopefully we're going to be getting these covers in to show the way to properly cover this when we're in a room that has a high exposure rate, like in anybody getting intubated or having procedures. Otherwise, the request is to wipe down the machine fully after you use it and use probe covers on all patient contacts.
So the first thing we're going to review is pulmonary ultrasound for pneumothorax. For this, you want to use the linear probe, and at the apex of the lung, a patient sitting at about 45 degrees, you want to place the probe in a superior-inferior position. This is the lung in between two rib spaces as he breathes. This is the pleural line. Take a deep breath. And as he breathes, you can see a slight movement of the pleural line. It's called the ants marching on the hill, and there's slight common tails here. If you put the M-mode cursor right through this, we'll get the sandy beach sign or the seashore sign, which is the waves crashing on the beach here. This is indicating negative pneumothorax.
The pneumothorax, this is a great way to exclude pneumothorax immediately. If you don't see the classic signs and the patient's stable, I would still recommend getting routine imaging for confirmation, as there are some instances in pulmonary blebs where you can have a false positive ultrasound scan. But this is nice after central line placement when you're in there and the patient becomes dyspneic or has respiratory distress. You can throw the ultrasound probe around their chest while you have it out. There's a lot of good instances to use this ultrasound to rule out pneumothorax quickly. What I'm going to show you is the identification of A lines on ultrasound. This video coming up next is using the cardiac probe to show the difference between normal lung tissue and abnormal lung tissue.
So this is the lung scan with the cardiac probe through normal lungs. This is the pleural surface, and then what we see here are A lines. So this is reverberation and mirroring here and here. This is essentially showing that there is nothing in the lungs, and because there's nothing in the lungs like fluid, the ultrasound machine is mirroring what it saw last. So here, here, and here. And these are equally spaced, and they're horizontal lines. Those are known as A lines.
Lines are good. A lines are what we see in normal lung tissue or in COPD without an infiltrate or any pulmonary edema or fluid. A lines are good.
So this is an example of B lines, which would be indicative of
pulmonary edema
or interstitial edema. Notice how in the same view we're seeing no A lines, no horizontal lines. We're seeing now vertical lines that go from the pleural surface all the way to the bottom of the screen. That is indicative of fluid in the lungs. The ultrasound waves are kind of transducing through fluid, and they're causing these straight lines. If you see three pleural lines, B lines, between a rib space, that's positive for interstitial fluid.
So to review, the best way to look for interstitial fluid is to use the cardiac probe and between the second or third intercostal space and midclavicular line. Look on both sides between the ribs. And if you see three of those B lines between the ribs on both sides, then that's positive for interstitial or pulmonary edema. So hopefully you found this useful. I'm going to put some links on the email to Sonocyte's webpage and EMCrit. They have good ultrasound information there. It's all free, open access. And so reach out to me if you have any questions. I think this is enough for today, and I'll get to the cardiac section as soon as I can. Thanks, guys. Stay safe.